Hi classmates, my name is Akia Isom and my presentation's on depression and older adults. So I'm going to go ahead and get started. So first I want to talk to you about the characteristics of depression. So according to the DSM-5, for a person to be depressed, they have to have at least 5 of the following symptoms, which is depressed mood most of the day, diminished interest or pleasure in almost all of activities, significant weight loss, insomnia, psychomotor agitation, fatigue, feelings of worthlessness, diminished ability, reoccurrent thoughts of death or suicidal ideation. These symptoms have to occur for at least a 2-week period, and then it also has to be a change from the way that they would normally function. And at least one of the symptoms out of the 5 that they're experiencing, or more, because they could be experiencing more than 5, at least one of them has to be either depressed mood or a loss of interest or pleasure. And then also the symptoms must cause either significant distress or an impairment in their social, occupational, or other areas of functioning. And then also the symptoms can't be caused by any other, medical or any other medical problem or, pharmaceutical drug combination or anything like that. Some of the unique things when you're talking about older adults and depression is that some of the symptoms and most of the symptoms that you would see in a younger adult with depression, you're going to see with older adults too. It's just that with older adults, they're more likely to have some somatic symptoms like nausea or, pain in their stomach or feeling, sick or different things like that, or like especially like the tiredness. You're more likely to see those somatic symptoms in older adults that are dealing with depression. And also, depression is often misdiagnosed or undiagnosed in elderly patients. It's often misdiagnosed because they may be experiencing another disorder, like they could have delirium, or they could be on too many medications, and those medications could be allowing, the patient to look like they have depression and really they're just on the wrong medications, or they could just be dealing with, other issues. And so it may seem like they have depression when really there's something else going on. And then also it may go undiagnosed because sometimes those signs and symptoms of depression are viewed as a part of the normal aging process. So being tired is viewed as being part of the aging process. Or, having some memory losses or some memory lapses is seen as being a part of the normal aging process. So those things wouldn't necessarily be viewed in an elderly person or an older adult as a change, but in reality, it may be different than what they would normally experience or how they would normally behave. So it could be that may be one of the symptoms of depression that's being overlooked. And also their sadness or their, dealing with loss of life, or having to cope with that may also be viewed as part of the normal aging process and not depression. Also, depression is more common in elderly or older adults who have major health concerns and live in a nursing home than it is with people that live in the community. So the statistics are that for elderly who live in the community, 1 in 5% of them experience depression. For those who live in their home but need health assistance in their home, 14% of them experience depression. For patients that are living in nursing homes, 29 to 52% of them have depression. And then for people with major health issues like cancer and heart problems, or, that are having like trouble with their diabetes, 39 to 47% of those people have depression. And then also there are some people, like I said, where there are times when you can be misdiagnosed and have dementia, or that, people think that you have depression, but you actually have dementia. And then there are also people that actually have dementia and depression at the same time. And so 17% of elderly patients that have dementia also have depression. So cognitive behavioral therapy and interpersonal therapy are just two, they're just two forms that I picked to talk about to treat depression. Cognitive behavioral therapy, or CBT, the goal of CBT is to correct the negative thoughts and behaviors. And so with CBT, you're using things like a record of your thoughts and a record of those of your experiences, and then you're taking those negative thoughts and negative experiences, and you're going over, what was going on with those thoughts or what was going on with those experiences, and really analyzing, if they were correct or not, so that, you can change and tweak those negative thoughts and negative behaviors. And then also CBT believes that when you change those negative thoughts or behaviors, then you can actually change the mood, because depression is, considered one of the mood disorders. And then interpersonal therapy focuses on identifying and practicing ways to cope with the goal of affecting how the client interacts with others. Interpersonal therapy may use role plays, supportive listening, and communication analysis. With CBT, the therapist and client work together to change the therapist's thought process. CBT is also educational. In interpersonal therapy, the therapist leads a collaboration between the therapist and the client. So both of these therapies, and with most therapies, the therapist and the client are working together to go through the process to change. For a case study, I just talked about one of the ones that Bob Knight wrote about in our textbook, and he presented Sarah, who's an 80-year-old woman, and her landlord is saying that she's senile, and Sarah herself is saying, that she's been having trouble with her memory, and that, she's sleepy, and she might look a little bit thinner, and the therapist even, notices that she's irritable, and that she seems to have some weight loss and lack of appetite. She has little interest in doing things. She talks about feeling loss and sadness. And Sarah, says that she just, thinks that what she's feeling is a part of the normal aging process. But, honestly, with the characteristics and the things that she's feeling, she's, honestly depressed. And she isn't, senile like her landlord thought, but that she's honestly going through depression. And then last, this is my reference slide. As you can see, the description about depression and the criteria for diagnosis came from the American Psychiatric Association, and then the information on interpersonal and cognitive therapy, some of it came from WebMD, and then others of it came from Recognizing and Treating Depression in the Elderly, which is a journal article, and then also some of it came from our textbook. So thank you for watching my presentation, and I've enjoyed the class with you. Have a wonderful day. Bye-bye.